A very warm welcome to each one of you who's tuned in today for this interview, which is very, very special to me, very close to my heart, with one of my most favorite candidates, a very important, integral part of my team at ADC Aspirants. I welcome you, Dr. Sangeetha. How are you doing?
I'm fine, ma'am. Thank you so much for giving me this opportunity and all this love. I'm so grateful to you.
Oh, no, no, no. This is all your hard work which has brought you here. And of course, we are going to talk a lot about, your journey. It's completely you. You have to take the center stage today. You're the one inspiring many, many people because every time I talk to anyone who clears this very, very tough, I wouldn't say tough, but stressful exam, it calls for a celebration, and you have a double celebration. I'll leave it to you if you want to disclose that or not. But for everyone watching us, this is Dr. Sangeetha. She's been with me for the past many years now. Started off with, part one coaching, but she's had such a tremendous quality of being so efficient and so, I would say, always trying her best to provide the knowledge that I decided to, have her in my team. And was I lucky or not? Dr. Sangeeta, you've been such an integral part of our team. There are times when I go to sleep knowing that you are there and you'll take care of the things that, probably I may not be able to. So thank you
Oh,
for all the, you know, uh,
that means a lot. Such
yeah.
words coming from you, it's itself a nice, it is an award for me. It's not
Oh,
less than that.
thank you so much. Well, we'll cut straight to the chase and we'll start from your journey. Could you tell our viewers a bit about yourself? Where did you graduate from? A brief introduction, please.
Yes, of course. Hello, everyone. I'm Dr. Sangeeta. I am from Kerala. And I recently, to be very frank, I do not even know how to begin. But then, yeah, graduation, it was 2016. I graduated my BDS from Mangalore, IIG Institute of Dental Sciences. Then PG, I did post graduation. I'm a periodontist. I cleared in 2020 from Rajiv Gandhi Dental College, Bangalore. And I straight away in 2022, I just searched for ADC, and I had no clue. To be very frank, I didn't know anything about ADC exams or anything. I didn't have any senior or anybody whom I knew actually who did this exam. But then I just thought I need to give a try. I just tried for Australian exam. I just tried ADC in Facebook, and that's when mom's name pops up, ADC aspirants. And I was so lucky that from there on, actually, I never looked backward. From there on, I just followed her and I joined her academy and I just continued my journey with her and with her help. Whatever she thought, to be very frank, everything, let it be. Like whatever she told, I did only that. I did not do actually anything extra from my part. I just did that and I believed in myself and her. And I just went on being consistently doing and practicing everything. And that's how
Yeah, that's a
it all
trait.
started.
That's truly a trait that I have noticed in you. And it's very difficult to find because sometimes people think of consistency to be very boring. They think, reading everything at the same pace and everything over and over again, it can, there's no spice in it. But actually, that's what you need. Consistency is what you need to pass this exam. We'll go back to, when you started, when this whole idea of ADC was conceived, because Dr. Sangeeta, like you, like me, there are many, graduates in India who think about it. You are an inspiration because you have, I don't think you have anyone in Australia except for a remote family friend, maybe. There was nobody, that you could call and say, hey, I'm planning to move to Australia, give me all the information. You did not, get married to somebody who was already here, which is a true case for many, girls as well. And it's all right. But how did the idea of Australia come into picture after doing your post graduation? How did that come through?
And so now, actually, I felt I deserved better. To be very frank, here in India, it's not that it's bad, but I think when you have your own clinic, maybe it's good. But when you're working under somebody, you're just exerting more of. There's more labor, and the salary which we get, what we get paid for, the effort is not. I think it's not equating. No, it's not equal. So I just felt, and again, the work life balance, which I really wanted. Okay, so I mean, something which I wish for from my heart. So I just, just did a little search. Definitely, I did a little research. I searched about which country would be best and all that, and Australia did come up among the top. And I also didn't have the, I didn't want to do a course again, or I had done my post graduation already, so I didn't want to join any course again or do my MDS again, post graduation again in another country. I thought Australia is a place where I could, directly work with my own degree. I just need a, qualification exam. Although I didn't know it's so difficult initially when I started, but then yes, eventually the whole motive was I have to start working once I just qualify this examination. My degree gets qualified, recognized there, and I can just start working
I think
and
these
have a
two
better
things
work life
that you've
balance.
mentioned, you're right. Both of them are so important. And for everyone who is jumping into it, if you have second thoughts, you'll probably have second thoughts for the rest of your life, is what I believe. Salary or, getting paid for what you deserve, why not? This is what I question always, everyone who has a second thought. Why not? If you've done post graduation, whether you or not you've done it, but if you're working hard, why not be paid for it, right? And secondly, work life balance, which we all deserve. So, two factors, I think you've already set an example. And all of you who have this thing, dilemma going on in your mind, money can always be earned. These things, they have to take a priority. And of course, you started working towards this, which is incredible. That was okay, the first step. You thought about it and you got right into it. I'm sure there must have been some steps
Yes.
which you must have overcome, some, discussions with family and everything. But finally you got into it. How was your written exam journey? Because I remember I've been with you. One thing that I want to tell everyone is Dr. Sangeetha was never in a panic mode. I've never seen you in a panic mode. You were always smiling. I think maybe that was with me, but you've always, whenever I've spoken to you after your written exam, I mean, when you had your exams, I remember you were smiling and giving me the feedback and everything. And but I want to know from you. I want you to share it with everyone. How was your experience? How did you prepare? And all of that.
Yeah. First of all, I would want to tell everybody that yes, I did not clear my exam in the very first attempt. Okay. And I'm not, I mean, it's not something to hide or I'm not ashamed of it. I definitely gave my try. And first, when I gave my exam, I tried balancing it with my work. I had done given neat, and I thought, it's just another exam, and maybe I'll crack it. I took it easy. But when I started preparing, I tried to manage it initially with my work, and I had not taken break from my work. And I gave my exam, and when I gave my exam, that's when I actually realized, okay, it's not that. I mean, the mock, we did not have Uh, that atmosphere where we are giving two times, the part one exam, it's basically 2 days exam where one day we are giving two exams. So usually our brain is trained that we give an exam and then it's done for the day. But here you have to restart again for the after the lunch break. After a break, again you give it, and then another from the beginning. Again you have to give another a whole set of 70 questions. So that's where the difficult part I faced, to be very frank. So first day when I went for the exam, the first exam went very fine. It was all right. It was all right. The second part, by the second part, my brain just literally shut down. It didn't know how to work. I just had food and I was blank, to be very frank. The second exam which I gave, it was blurry. The vision was blurry. I couldn't, I mean, I was just marking on things and I wasn't very sure, to be very frank, that, okay, this one didn't go well because, it was a little, mentally it was a little difficult for me to, accept. And I remember telling Dr. Hannah that I really do not remember what I did there.
That
And
is the
I don't.
response most of the people have, honestly, because there's so much buzzing on in your head, like so many scenario-based questions. It's
Yeah.
totally understandable.
Yeah. Then the second day, but my brain got used to it. Second day, I could give both the exams and it went fine. And as I said, my results came exactly like that. I had not cleared the second paper. The rest three I had cleared. So that was my first part's exam results. So it's very important that we work on our stress. We give a lot of mocks. As I said, I was trying to manage with my work and the studies. Probably I did not give much importance to mock exam, and it's really, really, really important to give mock exams,
Which
which
is
I
what,
had.
Dr. Sangeeta and I spoke about. Remember, after your exam, once you cleared and, once you started coaching with us after clearing your part one, that we should have these mocks as a part of the
Mocks.
curriculum, which is
Yes.
so, and that's what we are providing to our candidates. And it really helps because I get messages and you get messages from people saying that, oh,
Mhm.
I didn't know that I'm lacking in this respect. I wasn't
Yes.
aware. And
Yes.
once I gave the mock, I realized that. So, yeah,
Yeah.
please continue.
You exactly. You never know until where you stand until you give mock exam. You really don't understand. And the stress, even though you will be when you're attempting mock exam without a timer, it's easy for you again. But when it is timed, the game changes actually there again. So it's very important that way. And yes, again, then next time I thought I should give my all. I took break from my work. Thankfully, I had the privilege to do so. Everybody is not that, will not be in a position to do so, but I did have my family's support, my husband's support, and I could do it. And I took break from my work, and I prepared for again for the part one. And then I took like 3 months complete break from my work, and I started preparing. And yes, and thankfully with Dr. Henna's help and all the consistent
Yeah.
studying, whichever I did, I just
Very
to clear.
important pointer here, Dr. Sangeeta, that it's not everyone has the privilege to take off from work, but many people do. But they still keep working, thinking that, oh, should we give up or, because who doesn't like earning money at the end of the day?
Yes.
But you don't want to be giving this exam for the rest of your life. You can keep earning the rest of your life. So just,
Correct.
see how you balance everything. So that was really, really good. I mean, the fact that your mental state and what you changed, what is it majorly that you changed? So one thing is, of course, you took a break for 3 months. I also remember the second time around you were less stressed. Isn't that what you said? Yeah.
Yes, ma'am. Actually, yes, definitely. Because now you already know how the exam is
Yeah.
and how I have to deal with it. The stress, I know the second time when my brain literally shut down, it was because of stress. Because I'm not used to it. I got stressed. So I just learned next time, ma'am. Literally, I don't know if you remember, I was singing song. I mean,
Yes.
I was literally having song running in my head, and I was just cool. I just gave exam. I just attempted every question as if it's just just an OPK patient coming to me and how I would deal it. It was
Yes.
nothing. I did not take it as an exam at all, to be very frank, and it really helped me.
Exactly. So imagine that you're looking at or seeing patients, and scenario based questions are basically very real world scenarios that you see
Yes.
on a daily basis. And now, Dr. Sangeeta, because she's one of the tutors, one of the mentors, she curates all these beautiful scenario based questions. We put in a lot of hard work, giving our candidates the right kind of material that is needed. So it's literally like people are talking to you on the day of the exam when you're sitting in front of the
Correct.
computer. So yeah, that was beautiful indeed. So the part one exam is done, we get the results, and now the real timer ticks in for the part two exam, which is which a lot of people dread. And especially I must mention here that you've had no experience of working in Australia, which many people think it's really important that once you're here it's better and things like that. I know you may have an upper hand, but it's not the only thing that you need. How was your part two journey? You were, for OSCEs, we were together, of course. You were with ADC aspirants. Your own technical, preparation at home. What was your mental state? And you must mention, Dr. Sangeeta, I'll leave that bit to you, about how much time you had actually.
Yes. Oh, yes. I mean, mine was not an ideal case, to be very frank. I had to take because of some financial break. I had to take a break. I did not immediately start preparing for my second part two journey. I took a year's gap. I really don't advise that to everybody, and it's nothing. I mean, if possible, go right ahead with the part two preparation. But I didn't have that a chance. I took a break of 1 year almost, and then the second year. So basically, I've already lost two of my attempts. If you think in that way, for part two, within once you clear the part one exam, you have 3 years time usually to clear the part two.
Yes,
I think
and
there's a
now
subject.
remember, ADC has changed it to 5 years, which is so good.
Yes, yes. Now they have changed it. So during like, till this year, I think it was just 3 years validity, and now it's increased to 5 years, which is really good. And yeah, so we had just that 3 years. So I had the first year already wasted, my two attempts gone. In a year you have two attempts to give. So I lost the two attempts, and then I start preparing. Then I I joined for my technicals first. So again, when I went for the technicals, I remember all my batchmates already preparing for OSCEs as well. I had started a bit late again there. So I was a little lagging behind, and I was very stressed. I remember. I mean, it was stressful because when your counterparts are much ahead. Yeah, so that was a little stressful. And then, anyways, I started with my technicals. I did courses. Then I did start with the OSCEs. So when I started with OSCEs, initially it took more time. I could not balance both technical and OSCEs together. So I had to do technicals. I did first, and then when I started with OSCEs, I took literally break from technicals. I do not know if it is right or wrong, but that's what I did exactly. So I started with the OSCE preparation. It took some time. I took it slow. Initially, it was taking more time and to accommodate all the information and to practice and all. It is not that easy.
Yes.
To be very frank too, because it's your own way of saying, although we all are clinicians, we know how to take it, but to discuss, to gather more information, to read about it, the material, it takes time
And the
initially.
biggest,
So I
difficulty is managing the time, as
did.
you know as well now. How to accommodate all of that information to someone in a new environment and deliver it in the right manner without, raising too many eyebrows. It's a huge task.
Yes. The 10 minutes timer, it's so difficult as a person like me who actually spends a lot of time explaining to the patient. My appointments all goes to 1 hour. Half an hour is just for explanation, half an hour for the treatment. So I'm a person who explains a lot. For me to concise it in that 10 minutes, it was such a difficult task, to be very frank. It was very difficult. So we had to practice that. So to
Yes.
concise it in the 10 minutes, to cover all the rubrics and the concerns of the patients and everything. So it was little, that is what is challenging, and it takes time. Basically, it's not the information. You know, oh, what is there? It's just a case. You can do it. Yes, you can do it. But doing it in 10 minutes is the task.
Agreed.
So it took time. And yeah, so it took little time. So again, my part two exam, again, I did not clear my first attempt. I did clear it my second attempt. So the first attempt, again, this is what happened. I was a little slow. I took time, and uh, I had, I think, 2 months again, only 2 months time to prepare for my technicals again, because I got stuck with the OSCEs a bit longer, maybe 3 months just for the OSCEs initial preparation, and then 1 month for OSCEs, and 2 months for technicals. That's all, I think. And in the coaching center where I did my technicals, there I took time. So yeah.
How were you managing that? Like,
Yes.
how many days were you giving yourself?
Arranging that itself took a
Mm.
lot of time, ma'am. The
Mm.
setup to set up the home, setup, it takes time to arrange for compressor, to arrange for the mannequin,
Yeah.
all the seats, everything is so much. It took time. It was
Yeah.
not easy to set up a arrangement as well.
Exactly.
And yeah, I mean, at home I would have practiced like 1 month only, to be very frank, before my exam. I just got that much time only. And yeah, I went in for the exam. Yeah, even before that, the booking process was so difficult. The slot, the getting the slot
Yes.
itself was so difficult.
I think
It
you
was
got
so,
your dates 1 month before you had planned, right?
yeah, that is for my second attempt. And even for the
Yes.
first attempt, I had not got a slot at all.
Oh,
I received the mail. Yeah, when I was booking, when I received the mail, by the time I opened the mail, the booking had gotten over.
oh.
I mean, I was like so shocked because this was the third attempt I'm losing. I could not even apply. And it was very, I was literally like I was in shock. I was like, oh, I couldn't apply. Everybody was shocked around me, I remember. All my friends, everybody was like, oh, you couldn't apply.
Yeah.
But most of our friends that time could not apply. So it was not something only which I faced. Many of them faced because there was a lot of traffic that time, and most of the people could not book exam who were expecting to book exam that time. So that was one difficulty which I faced that time.
Yes.
So next time I was literally on top. We did not sleep. Literally, I think we were like awake, and as soon as the website goes on active and we book the exam. So yes, next time, first attempt when I went, I booked the exam. I got in. I was all whichever date I expected, that
Yes.
date only I had got it. It was good. The first attempt, the date whichever I wanted, that only I got.
Yes.
And yeah, I gave my exam, but it was good. It was not. I really had. I mean, I remember experience. Sharing the experience with Dr. Henna. I love the experience. I love the exam experience. It was wonderful. The examiners were all good. In the sense, it's not obviously they're acting. Uh, so they did their part really well, but they were welcoming. And the happiness which I felt, because I always wanted to be in Australia. So I am now in Australia. From India, I was preparing, and now I'm in Australia. That part itself gave me so much of happiness. Then I
I
gave.
must say, Dr. Sangeeta, this is something nobody ever says, and no, very few people, talk like this after the exam. Many people, 90% of them will just come and say, "Oh my God, it's over," and very few people will have the smile on your face that you
I
have
know, I
right
was
now.
very happy.
So this
I
is
remember
what,
the technical
everyone
room.
should feel, I believe.
Yes, that definitely that's I think a positive vibe. I mean, I remember being in the technical room for my exam and I'm smiling. I know I have the mask on, I'm smiling because oh wow, this is what I wanted. I mean, this is the oh, this is the handpiece. Oh, I have this dental assistant. This atmosphere is what I want to work with. The materials and everything. This is what I want. I had that strong feeling flowing in, and I was like, yes, this is what I want. And then I started with my work, my technique. I mean, everything went fine. I mean, exam was good. It was all fine. I was nervous, obviously, during the skilled OSCE part, especially because everything is different there. Even though I had got coaching, but it wasn't enough, and maybe I required more practice, which I had not got time to practice
Mm.
with at home. You don't have that mannequins and all at home,
Yes.
anyways. I had just taken it lightly, to be very
Yeah.
frank. I had not practiced much for the skilled OSCEs. I lagged there.
Okay.
So in the first attempt, and I could not clear my exam the first time when the results came.
Mm.
But as soon as the results came, the next in instinct, even for the part one, I remember soon as the result came, the very next second I decided to give my exam again,
Yes.
like
You had
again
no
attempt the
second
exam.
thoughts about
There
it.
was no second thought. No, I never gave a second thought. It was like instant. This thinking I have to give exam
Yeah.
again. So same thing happened. Results came. I was like, I did feel bad. Obviously, you feel bad during when you
Natural.
although you are hoping, it's natural. So I was like, no, I have to give one more attempt. Although even from the family, I remember my mother being saying, like, oh, it's okay. Now you leave it, you move forward. I remember, and I was like, no, I had tried so much hard. I think now I should give one. It deserves one more attempt. My results are not bad.
Yeah.
You remember, I mean, the part
Yes,
two
yes.
results are not that bad.
No,
So
no.
I was like, I do have hopes. And then I decided to give it again.
Yes, and I must say that, that is the kind of strength we need mentally. It's not just
Mm.
about practicing again, it's about, coping up with that stress of failure. Because I know most of us who give this exam, even if we've been average dentists, we've never seen failure, I think true failure. So when you see that fail result, I know it brings a shock within you, but the strength that you need to overcome that shock is what matters in the end. And you've shown immense courage and strength, Dr. Sangeeta, beyond words. And I still remember, cut to the day when you gave your part two second exam, and we had a normal conversation, the results. How was the feeling on the day? I know it's a very
Mm.
silly question to ask, but I want you to relive that.
So, even for the part two exam, to be very frank, it was all. I just wanted to share that experience as well.
Yes.
Like for the second attempt, how was it?
Yes.
So I basically knew where I had to work more. Okay, wherever I felt I need to, I knew I have to work on the OSCEs again because
Yeah.
the first attempt also I had not spent a lot of time. So I did. Now this time I knew I could balance it. I could balance both technical and OSCE together. And again I had almost 2 months time for preparing because again I did not get the desired date. I wanted it in November, I got it in September. So
Hmm.
literally like 2 months less time I got to prepare. So I had only in my hand again another 2 months to prepare. So I managed technical and OSCE all together. But this time I did like OSCEs. I did daily. I did at least one or two OSCE cases and also the technical cases.
Yeah.
I tried to balance it this time, and I was confident. I always, to be very frank, I was always somewhere in the back of my mind. I was like, I have to give my 100%.
Hmm.
So I was always hoping and praying that I am mentally present there. Whenever I'm giving exam, I'm
Yes.
mentally present there,
Hmm.
and I don't get carried away by the stress or tension or anything else.
Hmm.
Being my last attempt, to be very
Yes.
frank, that was my last attempt. So there was an added burden, and but definitely all these things are there back of the mind. But I didn't want all these things to affect my performance that day.
Hmm.
So I think ADC exam is all about you managing your stress level. Okay, like perseverance, being consistent and managing your stress. This is what you deserve. You have to attempt these
Yeah, that
exams.
constant talk that you've got to have with yourself, that what is it that I don't have that others who clear have? How are they different? I think that was one driving factor for me personally. Where am I lacking? If I'm lacking in something, I'll work towards that rather than blaming the system or rather than
I
blaming
never did.
others. You know,
True, true. I always felt they didn't have a choice, probably. That's why the
of
exams are there in place. And there
course,
was no point blaming the system or doing anything. I felt we had to work
true.
towards it. I never focused. My focus was not on the other side. It was just towards
Just
clearing,
towards the
probably,
positive.
whatever the
That's
just
that's very true, and
towards
I
the
think that's
positive.
how everybody should think. That's how everybody should, approach these exams. I remember when I got a call from
Yes.
you. First of all, we were expecting the results, and I knew that when I had just pulled out a tooth. I told you, remember, I had extracted a tooth. And I saw your call, and I was like, I'm not going to miss that because I knew when somebody passes, they call. When somebody doesn't pass, they send a message. So I wanted to take your call. I just quickly declubbed, sanitized my hands, and asked my patient to, shut his mouth. And I ran out of the room with the phone and I
Thank
said,
you so much. Uh,
tell me the good news. And of course,
yes,
you and I,
yes,
both of us were crying on the phone. It was such a
yes,
beautiful moment.
yes. Oh yes, it was something definitely. I mean, it does bring out tears because you have earned it. It's
Yes.
something.
Yeah.
It's something the words can't express probably that feeling. Yes.
Absolutely. No, you should be proud of yourself, Dr. Sangeeta. You along with many others who passed this exam, you're just paving the way, the right way for others who are still dreaming about it. There was a time when we were dreaming about it and we came across this and then we started getting into it and now others want to see this. So this is a medium through which people can actually relate. Somebody sitting in Bangalore can actually pass this exam, move to Australia and things like that. I One of the last questions that I want to ask you is what have been your biggest strengths throughout this 3 4 year journey, whatever it's been, and it could be, of course, your own confidence, your family, the support that you've had. We must give credit to every person, who's standing behind, right?
Yes, 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 definitely. I mean, I do not know where to. I don't. The order in which I'm saying is not the order of importance. It's the same level because even without at least one among
Yeah.
them, I think I wouldn't have been able to reach this position. So my family definitely, Dr. Henna. I mean, these my friends. No,
Yes.
ma'am, really, you definitely have an important part to play with. Let
Thank
it
you.
be because ma'am, I really did not. As I said, I did not follow anybody else. I just did not even explore anybody else. I just followed one person, and that I
So
just
sweet.
followed the guidelines and everything, whatever you have said. I did not go from behind. I mean, I remember people, searching and
Of
following many
course.
people, getting
Yeah, yeah.
confused. I didn't want that. I just
No.
didn't want to get confused, and I wanted to follow only one person. I just followed that, and my instincts definitely
Yes.
what to do. I worked on it. Definitely, I had that thing. I had that belief in me that I also could do it. And definitely, the family has been the obviously without them nothing would have been possible. That support and strength which I
Yes.
required wherever I needed, they were there always.
Absolutely. No,
My
this
friends, my friends. I mean, I cannot thank them enough. Again, even they were really supportive, and my batchmates.
yeah.
My the batchmates where when you do coaching, you have a team
Of
of
course.
batchmates, and they are also your greatest
And you
strength, your
become,
study partner.
yeah, you become connected for life because these are the days you remember 10 years, 20 years later that, oh, we used to study together and things like that. So
Yes.
always find the right kind of tribe is what I tell even the candidates
Mm.
on our
I
WhatsApp
was lucky.
community.
Yeah,
Yeah.
I was really lucky to have good study partners and who were, some. This could get a little competitive. I was really lucky to have really helping people during the
Yes.
study period as well.
Yeah,
That's important.
absolutely. People think that, oh, we shouldn't be sharing too many things. What
Yeah,
I
yeah.
always suggest is, and you know it as well, that on the day of your exam, have a very focused mindset. Don't go
Mhm.
around talking to people and,
Right. Mm.
like soaking in too much negativity or, giving off negativity. But
Mm.
have just that one person maybe next to you. And if that one person or two people are not around, just, just keep mum, give your exam and come out is what I suggest. But
Yeah, yeah.
it's been such a delight to talk to you. And I can't wait for the day when you arrive in Australia, you complete your APRA registration process, and you start working here and all of that. But of course, you being a part of ADC Aspirants is always so special. And I
Thank
just
you.
want to congratulate you once again for this amazing, amazing, journey that you've had, which has inspired many people. Thank you.
Thank you, ma'am. I just have one thing to say to everybody who's watching, that you need to believe in yourself. This is not something easy, but you can do it. If you really want it, you can do it, you will do it. You have to be just
Absolutely.
consistent and just have a good guide.
Yes,
All right.
very true,
Thank you
very
so
true.
much.
Thank you, Dr. Sangeeta. I hope you have a great rest of
Thank
your
you.
day
Thank
ahead
you,
and
Dr.
see you soon. Bye
Thank you.
bye. Thanks everyone for
Bye.
watching.